We also have some positive trends as we contend with this virus, but health officials still caution everybody, keep your guards up. We are joined now by Dr. Jeff Pothoff from UW Health. He's here once again to explain why. And I guess we have to remember that just because you're vaccinated does not mean you can't be vigilant. You have to stay vigilant. Correct, doctor?
It's true. So, the vaccines are great and they're wonderful, but, until we understand whether vaccinated people can still spread the disease to other people, we need to be masked, especially in public places. There is an allowance right now for people who are fully vaccinated to gather in a private residence, masks off, and not distanced. And that's just a taste of the future to come as more and more people roll up their sleeves and get vaccinated.
Yeah, it's a good thing, but we still have to stay vigilant. Now, what concerns do you have, Dr. Pothoff, about places in this country that might be opening up just too soon?
This is a real risk. The coming out of COVID isn't really a light switch. It's not on or off. It needs to be a dimmer. And with the introduction of these variants, which are much more contagious, some of these locations where really they have just opened everything up, that's risky business. And we've learned from the past that doing that sometimes sets us back. So, not a good solution to be throwing the light switch on, but things are looking good enough where we should be talking about what are those incremental things that we can do that maybe we couldn't do back in November at our peak.
Yeah, good point. Now, a lot of concern about these new countries in Europe that are finding a third wave of COVID, and they're shutting down places like Italy, and concerns in Germany. What is the takeaway for us here that we have to think about, doctor?
I think the European Union is kind of teaching the rest of the world a valuable lesson right now. Their rate of vaccination is a bit behind. They're not as fast as many other countries. And that really is the ticket. Those countries that haven't been able to vaccinate as quickly are starting to see a resurgence of the disease. Countries that have vaccinated really well, like Israel, they are not. So the way to prevent something like that happening here in the United States is to continue to have our foot on the gas on getting vaccines to vaccination clinics and people getting vaccinated. If we can keep the pedal to the metal on vaccines, we can avoid being like the European Union.
Yeah, let's hope so. And some European countries now are stopping or halting the use of AstraZeneca. In your professional opinion, doctor, is this warranted? What is your thought on that?
I don't think all the data is out on it yet. I would say that, anytime there's a concern that there's a serious adverse event from a vaccine, we should have a very low threshold to push the pause button and look at it. What I have heard is it looks like in reviewing the data that although those people did have blood clots, the rate of blood clots in people who are vaccinated with the AstraZeneca vaccine really isn't higher than the rate of blood clots in the general population. And if that holds true, that's good news. That just means there is an association between the AstraZeneca vaccine and some people who got blood clots, but the AstraZeneca vaccine isn't the culprit, isn't causing people to get blood clots.
Yeah, good to hear your thoughts on that. Dr. Jeff Pothoff, we appreciate you being with us once again and giving us your professional insight. Thank you very much.